Our guest on this episode is a trained behavioral scientist and sexual health educator who has centered her work on the complex intersections of race, sexuality, social justice, and health equity among individuals of marginalized genders. She was a guest on the podcast back in 2020, and so much has changed since then. And she now returns to share updates and more of her journey with us today. You're listening to the PHEC podcast, episode 349. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. Whether you are here for the very first time or you're a regular listener of the podcast, I'm really happy that you're here. I'll briefly introduce myself or reintroduce myself and tell you a bit about what I do, and then I'll introduce our guest and we'll jump into that conversation. So I lead a public health and epidemiology consulting firm that supports large nonprofit organizations and government agencies that serve Black, Indigenous, and people of color, commonly referred to as BIPOC communities. We are often invited to support tribal organizations, and we're always honored to serve. We help our clients communicate their data and health information in plain language to the communities that they serve. Now, this type of support builds and strengthens relationships between organizations and the individual community members. Some examples of the support that we provide include comprehensive toolkits, fact sheets, custom reports, community health profiles, as well as data-driven workshop facilitation that engages community leaders on specific disease or health-related topics that are most pressing within that community. Now, if your organization serves BIPOC communities or is genuinely interested in building relationships with BIPOC communities, then please reach out to us through our website, which is drchuntley.com. And we'd be happy to meet with you and explore how we might be able to support your organization. And the links to our website will also be provided for you in the show notes. Now, in this episode, my guest is Dr. Keosha Bond, who was also our guest back in episode 152. That was back in 2020, which feels like a lifetime ago. I encourage you to go back and listen to that episode as well. And we'll provide quick links to that in the show notes for this episode. So over the years, Dr. Bond and I have kept in touch, just following each other on LinkedIn. And I'm excited to have her return back to the podcast to share more about her journey with us, what she's been up to, what she's doing now, all those things. So let me formally introduce her to you, and then I'll connect our conversation. Dr. Keosha Bond is an assistant medical professor at the Department of Community Health and Social Medicine at the CUNY School of Medicine and the director of the Love Project Lab. She is a trained behavioral scientist and sexual health educator who has centered her work on the complex intersections of race, sexuality, social justice, and health equity among individuals of marginalized genders. Dr. Bond's primary research interests have focused on understanding how socio-structural and cultural factors influence the transmission of HIV to develop sex-positive, culturally appropriate digital technology interventions that empower people to change the status quo and achieve positive health outcomes. Dr. Bond's work has concentrated on developing innovative e-health interventions that interrogate the complexities of identity formation, systems of value, and the shared vernacular in and around Black visual culture to address sexual health. Her most recent projects include conducting formative research using mobile ethnography to develop sexual health interventions for transgender youth and women. Dr. Bond is also the co-PI of a multi-level, multi-component National Institutes of Mental Health funded study focused on supplementing traditional HIV prevention peer navigation with a user-curated, pleasure-focused, do-it-yourself sexual health self-care in a box in a community level anti-intersectional stigma multimedia ad campaign for Black, gay, bisexual, and same-gender loving men to increase HIV testing and PrEP uptake. Let's connect my conversation with Dr. Bond right now. Welcome, Dr. Keosha Bond, to the podcast again. I'm excited to have you back so that we can do a little bit of catch up. And so those that know you already can kind of be fun to hear your story. But for me, it's going to be great to catch up because it's been a while since you were on the podcast. We actually looked it up. It was summer of 2020, which is a very interesting time.
Yes.
So let's just start with you telling everyone a little bit about yourself.
Hi, everyone. My name is Keosha Bond, and I am a sexual health educator and researcher who focuses on looking at intersectional stigma as well as sex positivity among marginalized population as it relates to HIV prevention. So that's my story. I am a native of the Bronx in New York City, just in case people don't know, and I'm an avid lover of hip hop as well as gospel music. And I just love engaging in social media constantly as much as I can. And I say engaging, meaning that I like to watch the reels and the TikToks and stuff. I can't post too much, but that's who I am in a nutshell, really. And I'm just a family person. That's it.
Yeah, it's so nice to have you here. I think as soon as you said love of hip hop and gospel music, my first question was like, "Oh, do you like Kirk Franklin?"
Oh yes,
course,
definitely.
Right?
Yeah. Yeah. I always tell people I say I listen to hip hop when I need to focus and I listen to gospel music when I need to calm down. You can tell what mood I'm in based off of the music I'm listening to.
Oh, love it. Love it. This is great. I am really happy to have you back. Thank you for coming back to the podcast and to share with us. I still would like to ask the same question I always ask, but I think it's just really important to kind of scroll back a little bit and get a little bit of background and then kind of navigate that forward to get a sense of the journey. And since the last time you were here was before we had the COVID pandemic started, I think even your retrospective view might shift a little bit, you know? So my first question for you is, when did you first learn about public health or really consider public health as a career?
Oh, I think it was an undergrad. And which is a long time ago. When I think about it now, it was an undergrad, and I did my first internship with the New York City Department of Health. They had a training program, and I just, honestly, I didn't have my intentions were to go into public health, but I saw this avenue that I didn't know was available to me. Anytime when you think about healthcare, all of a sudden you automatically just think about medical healthcare. You don't think about the other aspects of health and that relates to social determinants of health and how that affects people. And that internship actually opened my eyes. And one thing made me realize that it's not the people. It's the systems that we have to live in that has a great impact on our health outcomes. And it's important for us to address those things in multiple ways, whether it's behavioral interventions or it's policies or it's just, making sure that people have adequate housing and education opportunities. So it's so many different factors that play a role. And that internship that summer really changed my perspective. And I was like, I don't know, maybe I'll get my MPH before I go to dental school. And then I got my MPH and I was like, I don't want to go to dental school anymore. And, that's how life is, really. Yeah.
That's really interesting because I often find that people kind of discover public health, myself included. But once we do, it's like, oh, this is really what I wanted all along. This is really, this is a fit for me. So definitely understand that. Now, I know you mentioned, your work in sexual health. Is there a particular population or condition or issue that you're most passionate about now?
Yeah, passionate about now. Oof. Well, predominantly most of my work is centered around the Black community. And so my work primarily is focused on how our sexuality and our experiences as Black individuals impact our engagement and care. And so that means I'm looking at Black people across the gender and sexuality spectrum. And I know a lot of times in research, they're like, well, how are you going to do all that? I was like, I don't know, but I'm managing it right now. Somehow, some way. Because I was like, there's an interconnection, regardless of your gender identity and your sexuality that is shaped by your Blackness, really, in the society. Like looking at womanhood, looking at manhood, looking at gender identity, looking at sexuality, it's always going to have that surrounding it and have an impact. And your experiences are just going to be different. And a lot of the work and research that has been out, really doesn't provide an avenue for the totality of the Black community. We always have this one monolithic narrative, and we've been writing this, especially with HIV work, for a long time. And we fail to really look at the strengths and the positivity within our community, the things that, I always say grant us the grace and the protection that, we need. And so with my work in intervention development, especially behavioral intervention development, I try to focus on that. I try to focus on the beauty of our culture and how multifaceted it is, and how even with the diversity within the Black community, we still have these similarities that are intertwined. And we also have these parts of, within our diversity that we're able to celebrate, to collectively. And so that's my approach. And it took me a while to get to that point, really, of really being like, you know what, this is how I'm going to do it. But,
Oh, wow. This is fascinating. Let's kind of go there a little bit further. Tell us about what you do now.
Okay.
And let's kind of go into a little bit more of how, because I can see you light up. This is important work for sure. And my mind is like, oh, tell me more. Tell me more. So
Awesome.
tell us about what you do now.
Okay. I always joke with some colleagues. They're like, Keosha got a whole bunch of research projects. But what's similar in all of them is that they are focused on sex positivity and pleasure, as well as the collective culture, I feel. And so right now, my largest project is R01, that is focused on increasing HIV self-testing, as well as PEP and PrEP uptake. PEP and PrEP are two medications that can be taken to prevent HIV transmission among Black, same-gender loving, gay, bi, queer, and other MSM Black men. And so that's the largest study that I got going on. And so we have it's RCT, it's a randomized controlled trial. And we also have a component where we're going to do a social media campaign and a print campaign. And I'm just overwhelmed by that. But, but I'm excited also because it's just allowed, sometimes, and I think in research, you don't get to be creative. And it's this is giving me space to be as creative as I possibly can. And so I'm excited about that and seeing how it progressed and what we're going to do and everything.
So is this through the university?
It's funded by NIMH. And its partner, it's a multi-PI study. So I have two other PIs who are at Columbia, and I'm at CUNY School of Medicine.
Okay, so I'm going to make sure we were guilty of this at first before we started recording, talking like everyone knows where it is.
I know. I try to give explanations in
right.
between.
So what is NIMH, just so that we're clear if anyone's listening? And I know you are involved in much research, but let's break that down just a little bit, make sure everybody's with us.
I know. So the National Institute of Health, which I'm pretty sure now everyone's very familiar with after COVID, has different institutions. And the National Institution of Mental Health is the funder of this study, and they provide a range of studies. And I happen to be under the category of for AIDS. So they have like studies that are just focused on like all other diseases. And then they have special categories for AIDS and HIV related research and stuff. And that's across the board in all the different institutions and centers in IH. So. Yeah, okay. So it's a large multi-year study, but every time, like I said, I get excited and I get concerned. Yeah.
Important work. I look forward to, when does your social media campaign start?
We expect to start enrollment sometime in the summer. And so midway of our first year of enrollment, we should be launching the campaign. So probably about the beginning of next year. If it happens sooner, I'll let you know, definitely.
And is it just focused on the United States?
Yes, this study is focused on the United States. We are primarily focused in New York City and and that's where we know where social media is going to expand beyond New York City, but like our print campaign is just going to be focused in the New York City area.
Nice. Yeah, you've got definitely have your hands full now. I'm afraid to ask this next question. I'm going to ask it anyway.
Okay.
Is this your sole focus, or are you doing other projects? Are you doing other things in addition to this very large grant-funded research project?
Yes. I am doing a lot of different things. And so when I said before that I focus primarily on Black community and other people of color, I have 3 studies. One is completed, one is almost completed, and the other one is about to start. So that are focused on the transgender community. So FACE study was formative research photo voice study, which I absolutely love because it was using digital photo voice. And it expands not just using like video chat platforms, but a whole other entity that is going to be featured in the paper. That got me really excited because what I like to do in my research, and I didn't mention this before, is to bridge the gap of accessibility using technology, and also, and that means incorporating it not just in like the delivery of the intervention, but using it in our methods, really. So this is a photo voice project that's taking traditional photo voice methods and using digital technology together, because we don't take pictures the way we used to, right? We all, like, I just remember like thinking about a vacation I went on like in 2013. I still had a camera. I was like, I don't even work with a camera anymore. I use my phone. And so we have to move along with that. Even in research, I feel like, how can we reach people? How can we make it easier for people to engage in the research that we're doing, as well as look for strategies for people to engage in care? So I'm excited about that. That study is completed, and it was with a diverse population of transgender youth. And it was exciting to like start the project and to get their responses of engaging in it, because mainly one of the things is like we use this platform called Indemo, and it was kind of like Instagram, but private. So, they were able to post pictures and respond to the captions in their captions to some of the prompts, and they felt safe. And that was one of the responses that we received during one of the photo voice sessions, is that, at first they was a little skeptical because of course, it's like, I'm asking you to take pictures of yourself in your life. But they, and even one of the participants said like, they went and they looked to see if like their pictures would show up somewhere. And afterwards, when they realized it wasn't, they just it was a sigh of relief. And I thought, I appreciated and hearing that or reading that from the interviews, because they felt safe doing this. And in social media, a lot of individuals in the transgender community are experience bullying and harassment and discrimination in these platforms. And so for them to say that they felt safe and it felt good to engage in this research project made me feel good. That means that I'm doing my job right, because that's the goal, to treat all of our participants and people, human beings, really, and not just subjects. So, yeah.
That's massive. That's a major win for research.
Mm-hmm. Yeah, and another project is Turn It Up, and that is, again, looking at how digital technology can support sexual health. And it's a formative research study, and it was with adult transgender women of color, and we're almost finished. We're got one more focus group to complete, and then we'll get to the data analysis phase of it. And this was really based in New York City. And again, I'm super excited to see what we get out of that and what we create and stuff. And I have another one with a colleague of mine, Natalie LeBlanc at University of Rochester. And it's focused on looking at PrEP uptake among Black transgender women and their partners. And it's focused in 3 different cities: Rochester, Buffalo area, New York City, as well as Miami, Florida.
Oh, wow.
Yeah, that's a lot. Yeah, it's a lot, but it's good. It's always good, I say. And my other study is, my last but not least, is focused on exploring how Black women who are living with HIV receive their perceptions about long injection medication and how that would impact their lives. So that's all I'm doing, I think. I think that's everything.
That's all.
For now. For now. For now. And I always said, everything came at once. And COVID, since it was this, during COVID, I also left my previous position. And so I was, going through a year of transitioning to a new position, new institution, and everything came back. And everything that I applied to actually got funded. So I was in a state of, okay, this is what we're doing. This is okay. And how it just never stopped. And so with that delay that happened with COVID, as well as being fortunate enough to receive funding, other things, it just seems like everything happened at once.
So that funding was connected to you regardless of the institution. So if we changed, it goes with you to the new. Okay.
Yeah, they were all connected to me. So, but again, transitioning from institution with grants and administration and stuff, it takes a while. It's a process. And so, but it's a good learning experience, I think, for me in doing that. And also learning how to do research in post-COVID times. I was trained, like I said, in my first instance in being a clinical interviewer. When I was an undergrad, I was in the clinic doing interviews with patients, and you can't do that as much as you want to now, and it wasn't, and during that time and for a couple of years in the city, it was challenging for so many different reasons. You don't want to overburden the community organizations that you're working with either, and they have their policies and they have things they need to do. So we learned how to rely on technology to get things done.
Oh, it's really fascinating. I might go back and listen to our previous interview again. Sometimes I'm nervous about going back, but your previous episode number was 100 and I think we said 154 when I looked it up. I'll confirm in the show notes. So you go to the show notes if you're looking for that one. Make sure you get the right number. But
I need to do that myself. What was I thinking?
Now this is really good. So I'm going to shift a little bit and ask you a question that is really to help. I think we have such a diverse group of people that listen to the podcast. Some people are, senior in their career and they just like to hear the conversations about what their colleagues are doing across different areas in public health. We've got students that listen for ideas and inspiration. And then we've got people who listen to the podcast who are not in public health, but they're curious and want to understand public health. So that range is, I welcome that. I'm happy to know that. So I asked this question kind of for that benefit of the broad and kind of diverse audience. So here goes. I want to kind of connect the dots. So how has the understanding of public health helped you to serve the communities that you serve and have greater impact?
I think with public health, like I said before, it allowed me to see beyond the person and the health outcome itself and look at what got people to in these situations, like what causes adverse health outcomes for people, really. And I think because, when I was growing up, it was all about if you do this, then you won't have these experiences, and that you yourself had all this power. And yes, I do believe we have autonomy in different things, but also we have challenges that are multifaceted, and we have to acknowledge that we live, even when we are trying to engage in healthy behaviors, there are going to be challenges that we are going to face because of our identities and our social identities in society. And I think that's what public health allowed me to see, and allowed me to see that it was important that in order for us to get to health equity, we need to change these systems. Like, it wasn't going to be because, yes, I'll lose weight if I don't drink soda, but there's other factors that may cause me to have a heart condition and other factors that may stress me out. Like, we look at, especially with maternal child health at the state level that we're looking at, especially among Black women. And one of the first articles that I read and explored talked about this 20 years ago, with the maternal and mortality rates, as well as the infant mortality rates among Black women and Black infants. And one of the things that came out was just like, it didn't matter about their education level. It didn't matter if they engaged in prenatal care. And people are like, well, what do you mean that doesn't matter? And it was like, well, look what they have to live with. Really, look what the everyday stressors and racism that they have to deal with, that constant stress that's in their life. And you expect for them to have, healthy birth outcomes? No. And we see, I'm happy now that it's getting the attention that it should receive, but this has been years, decades of this. And we're just finally bringing it out to the public, really. Like, we knew this, like, in public health, and we saw this and we understood this, but no one wanted to point the finger at exactly what it was. And I'm glad that we're starting to really recognize how racism has had such a negative impact on Black people in this country.
Yeah. So well said. I think that I don't think I can add to what you just said. I like everything you said. You not only, it's like multi-layered kind of aspects of the understanding of public health impact. And again, I think the part that's really resonating with me is that the topic and the example you gave, like with maternal child health, and there's some others that are finally surfacing and becoming publicly discussed, that I sit and think, well, gosh, this has been going on forever, as long as I've been around. I've heard my mom and my aunt talking about this, and now it's almost being presented as if it's brand new when we know it's not,
Yeah. And I was like, it's not you, It's so interesting. Like, I teach a course, Introduction to Population Health, at my institution, and I teach like first year students. Think these are their first year in college. And like, first set of lectures is when they start to see like, oh, this is bigger than me.
Oh. Mm-hmm.
Like, I'm here and I want to be a physician, but this this system that we're working in is bigger than me. These challenges that people are having, these health outcomes, it's bigger than just what I do in the clinical setting and stuff. And so I think it's great when they get that aha moment and see how valuable it is to understand that when they're engaging with patients.
Yeah. Understand. And such great insights. And I think this is the kind of conversation I would imagine when you hear it, you need to sit with it for a little while. And I think that it's good because especially when you say, this is big, that realization, this is bigger than me. I think in a lot of ways that has kept me pressing forward in my career, especially in the route as an entrepreneur, is I realize that, what I do, it's not just for myself, but it's way bigger. It's way bigger than me. So that is a realization that can also be very inspiring, especially for those young people sitting in that, in that classroom with you. Those are the things that will inspire like this next level of ownership and greatness and hopefully a bit of humbleness added and, kind of wrapped in there too. But yeah, that's really great. I'm enjoying this as well. I mean, very selfishly, I'm enjoying the catch up, hearing you and what you're doing.
Same here.
But I'm also loving it for the audience that's listening to us right now. I just have one more question. I'm kind of trying to be cognizant of time, but I think I just have one more question for you. And that is, again, thinking about, we've got a diverse group of listeners on the podcast. So if someone's listening and interested in what you do, are inspired by you, like, is there just one bit of advice that you could share or a tip that you could leave with a listener today?
So one of the things that I will say to a listener is really think about being the messenger and being an informed messenger. I think we all carry in our networks and in our groups, we have people who trust us. And being informed, being of knowledge of certain things, they're going to come to you. And so I think that's really important to understand that even you can play a pivotal role in how people understand certain information. And it's really valued. And like even connecting people to like a new health provider or just like a location on like social media, like a page that you feel that is very informative, especially for like somebody of your identity that you share that with someone else in an interest, and I think that's really important of understanding like how valuable you are as just a messenger, really. Experts can't be everywhere, but if you are someone who has a certain knowledge about certain things or you are aware of where you can get those knowledge, share it, provide that outlet for people, information for individuals in your network is so important. And every day, like I say, like, you know what, this is like, I said, that's where I want to be. Like, I don't want to just be like, I do research, but I also think it's very important for me to talk to people in different spaces and mediums and stuff. And so I think, and I see like how valuable that is for everyone to receive, to be able to go somewhere and be like, if I ask you this question, you're going to give me the best answer you possibly can, and a lot of times we don't have places we could go where we won't feel judged or we don't trust the people to give us the right information and be thoughtful about who we are. So that's why I say, like, be an informed messenger, really, that's valuable.
I agree. Like that's being resourceful, being that trusted source, that resource. That's great. I mean, how many times I'm thinking all of us could think of an example or a time when, we saw something that was very insightful that was shared, across social media, even thinking about LinkedIn and a post that someone shared because of who we follow in that network and how that, we were, inspired or enlightened because of that resharing of valuable information. So.
Yeah. And I also I get my friends and people I know, they will send me something like, what do you think about this? Because they're curious and they just want to know more. Mm-hmm. They want to understand really about certain things. And, and I think that's a positive really in this world, So I value health communication, and I think we all can play a role in that. We see how important it is.
Absolutely. Absolutely. Well, thank you so much for coming back on the podcast, giving us updates and just sharing such value. I am so inspired by you.
Oh.
You've actually made me think of someone else that I need to connect you with who's also passionate about research, especially in the Black community. That's Dr. Joy Washington. Are you connected with her already?
No, I'm not connected with her.
You absolutely need to. She's in Mississippi.
Mm-hmm.
You're, outside of the city of New York.
I know, but I'm looking to expand to do work in the South. I always say, I was raised by daughters of Black sharecroppers from North Carolina, so I need to get back to my roots and stuff.
Yes, I think she came to mind when you mentioned Miami. I thought, oh, that's way outside of New York. But then I just thought she's very passionate about research, and I think that the two of you, I'll connect you. I recently interviewed her, and I'm trying to remember, has her episode come out or when is it coming out? Because sometimes I do so many batch interviews early, so I'm dripping out secrets here that her episode's coming. But I will definitely connect the two of you. And as I say this, and we're on a podcast, and she's probably listening, going, "Oh my gosh, you can listen to it." I definitely think that she's someone that the two of you should have a conversation. So, but thank you so much for being here. I really appreciate you, and let's keep in touch. It's not going to be 4 years before we talk again, right?
We can't do that again. No, but it was so great. Thank you for inviting me back. It was so good to see you and just talk to you. I know we always talk as if we've known each other for years.
I know. And we keep up across social media. We just have to sit down and, so we just got to do that.
Yes.
A Zoom with no subject in the line, just a simple catch up.
Yes, definitely. That would be great. It's always great.
Well, you take care and we will be in touch.
Thank you.
Well, we really hope that you enjoyed our conversation as much as we did. Dr. Bond is a powerful leader. She's innovative and creative. She's a true public health professional. I encourage you to connect with her and learn more about the research and the work that she's doing. You can find the links to connect with her by visiting the show notes page for this episode, which is episode 349. And you find that by going to phecpodcast.com. And once you're there, just navigate to episode 349 and you'll find the show notes. Now, one more thing before we go. Do you know of anyone, student or career professional, who would be interested in learning about the creative and diverse ways that people are leading and serving in their public health careers? Well, please take a moment and share this episode with them. I'm sure they would be interested in hearing this conversation, the one that you just listened to on this episode. If you're listening in one of the podcast apps, then you can easily share this episode through a text or share directly to social media. At the bottom of our show notes page, you'll also find social media sharing buttons, which make it super easy to share this episode with your network. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.